but you mentioned that thing 5 times, but I think sometimes we kill our own time. This is something we are discussing with each other and teaching doctors. Okay, so this is the thing, when we keep repeating one sentence, that can eat up our
Oh,
own.
you mean like the sexually transmitted infection thing? Because
No, no,
I just want the person to aware of it. That's why.
no. It's not that. I'm glad that you come again. You mentioned that 4 or 5 times.
Yes.
So that was required 1 or 2 times, not more than that.
Because most of the patient I've met, they are so, especially in my country, in Asia, most of the people, they didn't come and seek medical attention. And whenever I mention like that, most of the time, whenever I mention like that, they never miss the follow-up anymore.
100%.
So
100%.
yes, so that's why I kept mentioning that, thank you for coming
Yes.
this to me, and
Yeah,
that's
this
why.
I 100% agree. At 1 time, 2 time, it was perfect. And I like that. But you keep repeating it, you kill your own time.
Okay. Thank you.
That would think. But again, you left with only 1 minute, you finished the station. So there is something wrong. What do you think? Why you finished before time?
Because I'm asking like I asked about the rash thing. I should have asked about any lump like gonorrhea. But I asked about the discharge. I asked about the
Yes,
peeing thing.
exactly. What I believe, this station should take more than 8 minutes if we follow the structure. I'll come to that and we'll discuss together. So yes, Ramesh, let's speak to the Ramesh, and then Sad. Consultation skills was amazing, but I'm talking about the structure in the PLAB pattern, how we can manage this. We shouldn't finish any of the station before time, I believe. Okay, I will talk about that and we'll divide. So Ramesh, I want you to comment on anything on this consultation and structure wise. PLAB-2, according to PLAB. I think Ramesh is busy now. Let's take Dr. Rafiq. What do you think about overall consultation?
Yeah, I think as usual, Dr. May, she got a very, very good consultation skills, of course.
Well
And
done, well done, May.
uh,
Amazing. So Sadia, what do you think? What things can be improved on in this station, and anything which was missing? Would you like to add on?
I think May did really well. She asked very specific questions and all the relevant questions. Her data gathering was on point. The only thing that I felt was a bit lacking, that she couldn't convince the patient about her answers. Like when the patient asked, "Doctor, do you think it is from my ex-girlfriend?" And from her answer, I felt like patient is not satisfied. Um,
And trichomonas vaginalis is only in the female. It's not I can get from myself. You answered that concern.
yeah. So there was
Comes from
Yeah, because he's mentioning about cheating, and I don't want to involve in some kind of
agree. I
situation.
will answer.
Say
I will
So
answer
so
that.
you could, yeah, so just say I'm not sure about that, but what I can tell you is that this is an STI, which means this is a sexually transmitted infection. You can't get it any other way than through sexual intercourse. And if you have not been active for more than one partner, I'm sorry to tell you that this is coming from your partner. I'm so sorry to break it down to you. So you have to be specific. You have to be, like
Yeah,
patient,
definitely.
bit more convincing.
I agree 100%. In this point, I was thinking something that you will answer that the same, like Swera said. Like I
thank
can
you.
tell you, it is sexually transmitted disease, and this is something which is specifically that bug is specifically related to the female part. Okay, so you can mention that because the trichomonas vaginalis. When I said I don't have symptoms, why you are giving me treatment? And I was not convinced by that answer. How would you answer that, Savera? That we need to follow the guidelines here because we
Sorry,
are.
what was the question?
The question is that I don't have any symptom. Why you are giving me metronidazole? Why you're
Yeah.
giving?
So you said, I understand your concerns here that you don't want to take medication without the results. But the thing is, because this is a sexually transmitted infection, and you just told me that you have been active and involved with your girlfriend, I'm afraid you might be a carrier for that. Like you might be carrier, and you might not be showing symptoms at this time. But you might be a carrier for bug, and for that, I'm giving you as a prevention. This
So
medication is
that
to
you might
prevent.
not transfer to your like your partner if you are planning to be get sexually transmitted,
Yeah.
sexually active. Okay, so that's fine. So bit of few things which was I would always say that I will try to break it down. But first of all, I want Ramesh to add on few things. Then I'll break it down because this is a new scenario which you might see in your upcoming exams. Yes, Ramesh, would you like to add on anything on that part?
So basically, I felt her consultation was good, but
Yes.
obviously a bit of like you were not convinced by whatever she was saying. So yes, and if she is saying, if you're saying that I really don't want to have this, so the answer is already addressed by Dr. Sadia that like obviously she can be a carrier and she can transmit it to anyone whom she has the sexual intercourse. Otherwise, I felt that it was fine. Yes, a bit of like structure could have been followed, like in a way it was like a bit haphazard as well. And
Yes.
also I would never advise anyone to complete a station like before time, because you're not going to pass the station then.
Yes, it's always highly commendable that you are paying £1,000 for this test for your future. Take your full time. And it's not nothing like that. Sometimes Ramesh, me and Maya, we always do very critical feedback to each other. Why? This is the way if you see different reels when baby is not eating and they do the stuffy, they smash the stuffy or something like that. It's a way of giving you teaching sometime. When I make mistake, Ramesh and May, I appreciate that because Ramesh and May critically tell me that Dr. Zeeshan, you missed that. And the same way I do that. And the learning point is here that you guys learn from others' mistake. So you will have this in your mind. So the best thing to go in detail about that. So this important thing is the NHS guidelines. This is a new scenarios. So what you need to know. So first of all, I'll tell you 4 points in this scenarios. What after that, Ramesh will do that. Sexually transmitted diseases. What should be the approach? So in the start, it should be thank you very much. She said that for coming up for to the gum clinic, and she started very well that your ex-partner mentioned about that, and that's a great thing that you are here, and so that we can screen you for everything, including that what you said. But to make sure that you don't have any sexually transmitted diseases, I need to ask you more questions. First of all, I would like to know how you're feeling today. Just ask general question, and that question would, do you have any fever?